Okay, well, good afternoon, everyone. My name is Dave Henry. I'm the health officer for the Monmouth County Regional Health Commission, and I welcome you here today for our presentation about the Vulnerable Populations Assessment. Basically, at this point, both the Monmouth County Regional Health Commission and the Manalapan Township received the Vulnerable Populations Coordinator Grant from the State Health Department to identify and assess the vulnerable populations of our communities to COVID-19. We thank you for responding to our community survey. You have received a copy of our assessment already, and we'll be receiving a copy of the slide presentation. Our speakers for today are Connie, or I should say Conchetta Polanski, who is our regional health educator, Cynthia Weaver, who is our consulting health officer and lead vulnerable populations outreach coordinator, and Peg Huey, our vulnerable populations outreach coordinator, who is working with Manalapan Township through a shared service agreement with the Monmouth County Regional Health Commission. So again, we welcome you, and we would ask that you would fill out the chat box on the side to let us know that you attended. Please enter your name and your town. This meeting is being recorded so that we can share it with the Zoom meeting attendants and those who were not able to attend. So thank you. With that, I will share my screen, and then I will turn this over to Connie to start.
I can go into the first slide, which is really the 10 essential public health services. Hi, everyone. This is Connie Polanski. Thank you for joining the call. I'm just going to go through the first few slides, which really talk about our 10 essential public health services, what that means for us as a health department, and what the grant is and what the grant goals are. Here we go. Essentially, the basis of what we're doing is really looking at equity. That's kind of what this vulnerable population grant is. And the reason for that is that, recently the 10 essential public health services, which is a framework that was created by public health leaders to provide specific guidance for health departments and policy makers to protect the health of our communities. And so this framework, which provides 10 areas of services that health departments are supposed to cover, really try to achieve optimal health for all of those in our population. And specifically, it's been recently revised to really look at equity as the core of all of these services that we're required to do. So this requires a specific attention to health inequities, which are differences in populations, health status and mortality. Thank you. And while you're doing that, okay. So we're looking at health status and mortality rates that are systemic, that are patterned, unjust, and actionable. And before, so a lot of what we're doing here is really looking at equity. So you can see through that circle that equity is the core of our framework of what we're doing. And that really is the lens we used when we looked at COVID-19 in relation to the vulnerable populations assessment and what we're talking about today. So you can go to the next slide. Perfect. So early this year, end of last year, and Dave, I'm sure you can correct me on that date, Monmouth County Regional Health Commission and the Manalapan Manalapan Township received the Strengthening Local Public Health grant. And this grant was provided to or awarded to multiple health departments across the state, specifically those who are non-link agencies. And the grant, the goal really is essentially to, and I'm going to read it, to ensure that our at-risk residents have access to testing, vaccination, and support services such as housing, primary care, insurance coverage, unemployment compensation to allow them to quarantine, and to identify our vulnerable communities and assist with supportive services during the COVID pandemic. So the first stage of the grant is really to conduct assessments within each municipality, so we can identify the populations in need, and that's the assessment that we are presenting to you today. Our second stage of the grant is to use the information and help create a strategic plan to prevent, test for, and contain and mitigate COVID-19 within these populations. And so that's kind of what we're working towards. Essentially, the idea is really to use the funding to help reduce COVID-19 disparities and assist communities in need by providing access to testing and vaccine distribution. Next slide. So this is just a little bit about the two, the data that we're presenting today is going to be based on the 160,000 residents within the 18 municipalities that is served by the Monmouth County Regional Health Commission, and data specific for Manalapan Township, as we are working closely with Manalapan to provide this assessment. Next slide. Perfect. So what are vulnerable populations? Well, this definition is really provided by the state and defined by CDC, really. So what we're looking at, vulnerable populations are defined as those at greater risk for poor health status and health outcomes, those who experience significant disparities in life expectancy, those who often lack access to healthcare and to social supports, and those who experience increased morbidity and mortality. You'll see later. So this list is long, but it really represents the populations that were identified as vulnerable as it pertains to COVID-19. The list provided by the state was used as a guide during our research in identifying the commission and Manalapan populations. You'll see on the left, the list focuses more on social and economic opportunities of individuals. It also lists those who are already hospitalized or who may be hospitalized as the non-hospitalized patients. The list on the right focuses on age, long-term care residence, workplace exposure, underlying health conditions. And this was really our guide as we were trying to figure out, do these populations exist within our region, and how do we identify where they are? I will now pass it over to my colleague.
Hi, I'm Cindy Weaver. I'm going to go over some of the age demographics. So 18.2% of Monmouth County residents are over the age of 65. Spring Lake, Deal, Seagirt, and Interlaken each have more than a third of their populations over the age of 65. And Manalapan has 16.2% of its populations in the 65 plus category. Data shows that COVID-19 has impacted racial and ethnic groups differently. The information below is from the most recent census data on Monmouth County race and ethnicity. So 75% of Monmouth County is white. The median income is higher than the rest of the state. The county has a highly educated population, many with graduate degrees. And based on the 2016 Monmouth County Community Health Assessment, between the years 2000 and 2010, the Hispanic population grew by 59.6%, which is greater than the state average. I'm going to give the presentation over to Peg Huey.
Good afternoon, all. It's nice to meet you. I'm Peg Huey. I am a VPOC, and at this time, I am assigned to Manalapan to help them and their communities through this COVID pandemic. This slide that you see now, 88.5% of the population in Manalapan is white. Okay, the median income is $122,304, which is it is higher than the state median income. Manalapan has an even greater percentage of individuals with postgraduate degree at 25% higher than the county. Okay, the next we're going to address is health. Adults 65 and older have been adversely affected by COVID-19 throughout the nation. Older adults are at greater risk of requiring hospitalization or dying if they are diagnosed with the COVID-19. Within Manalapan and MCRHC's jurisdictions, the populations 65 and older are found in a variety of living settings. They are including, but not limited to, long-term care facilities, 55 and older gated communities, affordable housing complexes, and also living with family members. Additionally, the New Jersey Department of Health reports that people with underlying health conditions were found to be 6 times more likely to be hospitalized and 12 times more likely to die. We're going to move over to mental health and behavioral health. In 2020, residents in every MCRHC community and Manalapan sought mental health services or addiction treatment services as reported by New Hope Integrated Behavioral Health Care in Marlboro, JSAS Healthcare in Neptune, and the Mental Health Clinic in Monmouth County. Many services offered pre-pandemic. Let me rephrase that. Many services offered prior to the pandemic and have cut back their hours or offered to shift totally to telehealth. This shift has been cumbersome due to the steep and swift increase in the needs of these services. And far into education, we have remote learning was particularly challenging for elementary and English as a second language students who were on full remote or hybrid schedules. Many of these students were challenged by the online or remote experience. During this pandemic, school districts have made significant changes, and the impacts on families, student health, and academics continues to be unknown and continues to be assessed. On next to employment. Okay. Persons working in leisure and hospitality, transportation, trade and utilities, education, and sectors were the hardest hit by unemployment during the COVID-19 pandemic. Many of the individuals working in these sectors were Latino, non-native speakers of English, and women. In 2019, unemployment in Monmouth County was 10,900, while in 2020, numbers jumped up to 20,900. Now I'm going to switch back to Connie, who will continue on.
Actually,
I'm
it's
sorry.
Cindy.
I'm sorry. I'm on to Cindy. I did that.
That's okay.
Okay. Take it, Cindy.
Okay. So the provision of human and social services, the Monmouth County Division of Social Services and the Monmouth County Visiting Nurses Association reported an increase in the number of people accessing and using their services. The Visiting Nurse Association runs 3 of the 4 federally qualified health centers in Monmouth County. As a side note, all of the towns, including Manalapan, receive social support services from Monmouth County Division of Social Services. Community resources. Community service providers such as Community Affairs and the Resource Center demonstrate that there has been an increase in the demand for food assistance and rental assistance. Several facilities, including Samaritan Center in Manalapan, have changed distribution methods as families pre-COVID-19 were able to walk into the facilities and pick out what food items they wanted. Due to the pandemic, they had to organize drive-throughs where people got packages and they had no food selection. So in summary, there's a higher percentage of people 65 and older in Monmouth County. Within the Monmouth County Regional Health Commission catchment area, there's 18 independent senior living communities and 14 assisted living facilities. In Manalapan, there are 4 independent senior living communities and 3 assisted living facilities. The Hispanic community is growing exponentially in Monmouth County. In this community, there may be a lack of appropriate housing, causing overcrowded living facilities, potentially creating COVID-19 hotspots. And as we know, Monmouth County, there's very little mass transit, making it difficult for people to access resources. Mental health issues have been exacerbated across the United States due to COVID, and Monmouth County has also been affected by that. Oops. Okay. So as Connie said in the beginning, the Vulnerable Populations Assessment has focused on information gathering, and it was meant to provide a reference point for investigating what degree COVID-19 has affected certain populations. Now that the populations are identified, we can target education, testing, quarantine, and vaccination efforts towards these populations. Many of the findings are not unique to the municipalities in Monmouth County, although the demographic makeup of our jurisdiction may render unique response that focuses heavily on the senior population. So does anybody have any questions? And you can feel free to either put it in the chat box or, okay, or unmute yourself. Okay, so I guess no one has any questions. The next phase of the grants begins July 1st, I believe. And we haven't quite received our marching orders as to what we're going to implement, but we do know that it has to do with vaccination, education, and helping the vulnerable populations receive resources they might need for COVID-19. So I'd like to thank everybody for coming. And if nothing shows up question-wise in the chat box, we can call it an afternoon. Okay.
All right, thank you, speakers, and thank you for the presentation. And again, we'll be sharing this information with all the participants who participated with us. Thank you again for participating, and please feel free to reach out and contact us if you have additional information or areas where we need to continually look at in regards to both assets and gaps, so we can help identify the needs of the vulnerable populations in our communities. So again, thank you very much. Thank you for participating. And let's see. And again, thank you all for helping us in this regard. And we look forward to continuing to work with you. Thanks again.
Thank you.